Hi, everyone. Thank you so much for joining us for a webinar to learn about seizure tracking, why it matters, and how to do it. My name is Brandy Fierman. I'm the Chief Outcomes Officer at the Epilepsy Foundation. And tonight we've brought together a panel to talk you through why seizure tracking matters. We have some awesome speakers tonight. Dr. Ficker is a professor in the Department of Neurology and Rehabilitation Medicine at the University of Cincinnati, and helps to direct the Epilepsy Center there. He is also the chair of our professional advisory board and has been a great friend to the Epilepsy Foundation for many years. Welcome, Dr. Ficker. We also have Jessica Veach, who is a wonderful member of our staff. She's also a person living with epilepsy, and her day-to-day job is to be an operations manager for the Western region of the country. So Jessica is going to be able to tell us about her personal journey with epilepsy and tracking her seizures and how that's helped her. And we're welcoming you, Jessica. Thank you for joining. Finally, we will have an exciting discussion from Shalkasia Lessington, also a member of our team. And Shell is a patient engagement specialist who's working on the newest tool that we are developing here at the Epilepsy Foundation to help people manage their seizures. This tool is called Eden, the Epilepsy Digital Experience Navigator, and one of its features is an ability to track your seizures using something called S-Check. So Shell, welcome. We're looking forward to what you have to share with us about Eden. I'd like to thank the sponsors of the Eden project, which are Eisai and Otsuka. We appreciate their generous support and their vision for how we can build tools to help people living with epilepsy. So Jess, I'd like to start with you. Could you tell us a little bit about yourself, your epilepsy journey, how seizure tracking has played a role in your experience?
Sure. First of all, thanks for the introduction and inviting me here tonight. So I had a tonic-clonic seizure when I was 16 and I was camping with friends, and the doctors, just said, "Oh, you were dehydrated, lack of sleep. That's probably what it was. Just let us know how you're doing." And I was fine for several more years until I went to college. And then the seizures came back and they were more frequent. They presented themselves differently. They are now focal aware seizures. And so that's when seizure tracking first, became really important to see what was going on, how often they were happening, what else was going on during that day and that time. And then, then they were controlled for a while. And then in 2010, they came back, presented themselves differently again. And I had to stop working, stop driving. Fortunately, I was a candidate for surgery and have since been seizure free. But, seizure tracking,
news.
Thank you. It's very exciting. But yeah, seizure tracking was definitely part of the journey.
So you know what, Jess, you said something that I want you to expand a little bit more on, and that is that your seizures came back, but they were different and they were focal aware seizures, I think you said.
Yeah.
So some folks might not be familiar with that term. What does that mean, focal aware, and what does that look like for you?
Okay, so at the time, they were called simple partial seizures, and they were triggered by a loud noise, such as an airplane, even a hairdryer, and my eyes would just twitch. But I was totally aware during it. I could talk, and so that's one reason why it took so long to be diagnosed, because that's not what we thought of. That can't be a seizure. We never heard of such a thing. And so that's those types of seizures. And then when I mentioned they came back again in 2010, then they became focal impaired awareness, where, I was unaware the whole time, did not remember anything. And so that was just a more kind of scarier case, where that's why I had to stop working and driving.
Absolutely. Thank you. And Dr. Ficker, I see you nodding your head. You are familiar with some of those stories, right? Can you tell us a little bit about, the types of education that you give to patients when you first see them about how to start tracking their seizures and why that's important to you as their physician?
Right. Yeah. So again, I also want to thank Randy and the foundation staff for the invitation to present here as well. So it often depends on where that patient is in their disease course. So if it's a patient who has new onset epilepsy versus somebody that has longstanding epilepsy or maybe even difficult to control epilepsy, the approach may be a little bit different. So for a patient with new onset epilepsy, we spend time talking about the different seizure types, the different seizure categories, whether they're focal onset or generalized onset, and how we approach treating them. But part of that education also includes the importance of keeping track of seizures and other potential circumstances surrounding those seizures. Similarly, in patients with longstanding epilepsy or even difficult to control seizures, tracking seizures is extremely important. And the main reason is that's our primary outcome that we're treating. So our treatments are directed towards seizure control, seizure freedom, ideally, or improvement in seizures, depending on the circumstances. And really, the only way to know that is if an individual provides us with the information about when they've had their seizures, how often their seizures are occurring. It can be challenging, though, in that patients may not remember their seizures. So they may not have, some patients will recognize having the aura or beginning symptoms of a seizure and recognize that, or even after a seizure is over, they may recognize something may have happened. But some patients just have no recollection of the seizure. And in that instance, I think tracking is extraordinarily important, particularly if individuals have a family member, or caregiver, or friend witness a seizure. It's important for that to be tracked. And the reason is that, there's intervals between our patient visits, and we want to know what's happening in that interval, whether the seizures are controlled or not.
Absolutely. So you may need some help in tracking your seizures. I think that's a great point, that and it's not that it's someone's fault that they don't remember or can't remember the seizure. It's actually the same circuitry, right? Sometimes that can be involved in memory formation is the same circuit that is involved in the seizure. And so, of course, you can't remember something that is involved in that seizure. So Jess, for your experience, what were the ways that you used to keep track of your seizures? Did you use a paper diary? Did you keep it in a spreadsheet? How did you go about doing that?
Right. I kind of did it two ways. I had a paper calendar, just, like the monthly calendar. And so then I would put the number of seizures each day. And that was just a good visual to look and be like, oh, look at that, weekend was a really rough weekend. Was I traveling? Was I sick? That type of thing. And then I also just have a draft email that I've been adding to for years. And part of that is because, it's on my computer. I'm on email frequently. So you just kind of can add the date, what happened, and, what my husband told me I did or whatever. And so those are kind of my two techniques, and then you can compile them and find the patterns, find why maybe something happened that one week or that one day.
That's great. So I heard you use a method that is easy for you, right?
Right.
Whether
exactly.
It's a paper calendar or something, you're on the computer all day, so it's easy for you to use a computer document. That's one key ingredient, is that it has to be easy and accessible to you.
Yes. I'm not going to journal out as much as I could type real fast. So I just realized that was more helpful.
Exactly. And then the second is that you called on some backup, right? You asked your husband for anything that you may have missed. Excellent. Yes. And Dr. Ficker, can you say a little more about what is the type of information that you'd like to get from a patient? Probably not just the number of seizures, but what other kinds of information is helpful?
I think at a minimum, definitely we want to know the number of seizures, preferably the type of seizure, whether it may have been a focal aware seizure, focal unaware seizure, or a generalized tonic-clonic seizure. Timing is helpful because we do see some epilepsy syndromes that only occur at certain times of the day. For example, certain seizure types may be only in sleep, and it's helpful to track that. Also, there's a particular epilepsy syndrome where the seizures occur shortly after waking up from sleep, and knowing that pattern is helpful in us determining the specific type of epilepsy someone may have. I think also looking at particularly women with epilepsy, whether there's a relationship to the menstrual period, because that has implications, and we may look at not just treating with anti-seizure medications, but other treatments may be helpful in those circumstances. I know we're going to talk a little bit about seizure triggers. I think it's helpful to track at least the known triggers, like sleep deprivation, or if there happens to be a missed medication. are important things to track. Although I do, I do have some of my patients get very detailed in some potential specific triggers, which, we have to be, I want to be a little cautious in that, because we don't want to just attribute a seizure to a specific trigger and not necessarily change our treatment based on that. And so one trigger that's commonly reported is stress. That's really hard to track and measure, although there may be some tools that help us with that. I don't necessarily, and I tell my patients, I don't want to just assume your seizure was related to stress. We're still going to look at making adjustments in your treatment because you had the seizure. So that's one caution I have with specific triggers, is that we don't just want to assume that that seizure occurred because of that trigger, and we're not going to change our therapies based on that.
Right, great. So I definitely heard you say that one of the important reasons for tracking seizures is because it will help inform when you need to make a treatment change. Right.
Absolutely.
And I really appreciated that point about for women with epilepsy, there can be a pattern that's associated with your menstrual cycle. One of the things that's been so interesting to me in watching the literature is that there are more and more types of patterns that are starting to be identified for people with epilepsy. And it's actually not just women who might have a pattern that we could recognize if we took pretty careful notes on when seizures happen. And so learning those patterns can actually be helpful for anybody who has a pattern that we can then use to help guide treatment decisions. Thank you. So let's talk a little bit more about triggers. You mentioned a few that are pretty common for people with epilepsy. One is having a lack of sleep. If you're not getting enough sleep, you are often at higher risk of having a seizure if you have epilepsy. Another you mentioned is missing medication. And that is one that we worry about quite a bit, because when someone misses medication, their seizure threshold obviously, is pretty fragile. And sometimes your seizures can be worse if they are coming through, medication breakthrough. So how do you counsel people to try to remember taking their medications as one way to, couple that with keeping your seizures under control, keeping your medications on schedule?
Yeah, I've learned a lot actually from my patients. A lot of patients are using technology, whether it's an app on their phone for medication adherence, or using phone alarms to set a specific alarm at a specific time of day. One of my patients just a few weeks ago informed me that you can ask Alexa to set medication reminders. So if you have an Alexa, you can just say, "Hey Alexa, remind me to take my medications every day at 9 a.m. Siri does it as well. So those are sort of technological ways of doing it. One of my other patients told me of a very low-tech way. He takes his medications twice a day. He's on one seizure medicine. In the morning, after he takes his medication, he flips his prescription bottle upside down. So there's a visual feedback that he's actually taken that medication. And then at night, when he takes it before he goes to bed, he flips it upright. And so I thought that was a pretty unique way of doing it. I have other patients,
great idea. Yeah. Absolutely.
It's very low tech, but it's a vision for him. It was a great way for him to have that visual reminder that he took his medication.
Absolutely.
Pill boxes are very common. Patients will and family members will put medications out for the week or 2 weeks to have like an AM and PM slot in the box to help them with medication reminders. And I have plenty of patients that have backup. They have family members, spouses, friends that will text them or remind them to take their medications. So a whole host of different ways that can be utilized. And if somebody's having trouble remembering, ask your family members or friends for help too. I can reach out to friends for help in helping with reminders.
Yeah. Brandy, really quick, can we ask the attendees how are they, how are they tracking their medication? I would love to see that. And Dr. Ficker gave a lot of great ideas. The flipping of the bottle is a really good one, but I wanted to see if any of the other attendees, if there's ways that they are tracking or keeping track of their medication, because that would just be helpful for us to know.
Absolutely, please. I think you should be able to put that in the chat.
Chat box, yeah.
And we'll be able to see
And we'll
that.
just, yeah.
Okay, while we're waiting for some of those answers to come in, we did get a great question from someone who said, what if you live alone and there's no one to witness your seizures and what they look like? This is a person who has temporal lobe epilepsy. Suggestions for somebody who lives alone.
Yeah, I think that's probably the most challenging situation for tracking seizures. I do have a number of patients where they do live alone, but they have, they see family members pretty regularly or friends. And so getting that feedback from friends if there's a seizure that's witnessed is helpful. And trying to utilize, maybe even use some clues that suggest a seizure may have occurred, whether that individual might have tongue biting with a seizure or even a lapse in time, or I think sort of using clues like that to help them determine that there may have been a seizure. It may not be, a definitive situation that seizure definitely occurred, but at least it's clues, and it helps the provider at least make some treatment decisions. There are tracking devices out there, but primarily they are good at tracking convulsive seizures, right. But a focal unaware seizure where there's not a lot of motor movement may not be tracked. And that's, I presume that's what this individual was asking about, because temporal lobe seizures may not necessarily be associated with convulsions or general tonic-clonic activity. And so it can be really, really challenging.
Yeah. For folks who would be interested in looking at some of those seizure tracking devices or apps, our partner, Danny Did, has a really wonderful website that goes through some of the different available devices, some of the features, some of the things that you might want to think about different devices and their capabilities. So I definitely encourage anybody to take a look at the Danny Did's website and use the information that they've put together on comparing different kinds of seizure monitoring devices. We're getting some nice answers in the chat, and I see that someone suggested there's a free app called MedSafe that will help you identify a caregiver to get an alert if you forget. That sounds like some nice features. Someone who is on an epilepsy support group, and they get a reminder every night from Facebook, which is terrific. And a pill box, taking it at the same time every day. As we talked about building habits and building adherence so that you're taking your medications at the same time every day, that's also an opportunity to tie your seizure tracking to your medication. So when you take your medicine, say at night, you could also write down, did you have any seizures today? And just tying those two habits together can make it more likely that you'll religiously track your seizures at the same time as you take your medicines. So lots of different tricks, and we can learn from each other what works well. I really like that, turning the pill bottle upside down. Very easy, but very effective. Okay, so if we turn to different ways that you can track seizures, we've talked about paper calendars. There are actually forms that people have created that you can print out and fill out that form each day if that works for you. But there's also a number of apps and electronic tools that are available for tracking seizures. And I made sure that I did a little bit of research to try to find as many as I could so that we could mention some of them here on this webinar. Definitely want to share this list with people, and I'll try to go slowly in case you're taking some notes. But some of the seizure tracking apps that we're aware of are Seizure Tracker. Another is called Dial. Another is EpiPal. Another is My Epilepsy Diary, which is produced by a company called iRody. There's a group which is not yet available in the US, but is very active and effective in Australia called Seizure. We're hoping that they'll make it over to the US soon. And finally, the Empatica watch has a seizure tracking component as part of their seizure monitoring device. So those are apps that we're aware of. Now, that's not necessarily, an exhaustive list. So if others know of apps that you are using to track seizures, please feel free to put those in the chat. And we can also go through the list again. Yes, and I can put those in the chat so that folks can get access to that. So the website to look at devices to monitor seizures is Danny Did. And the list that I just read off, I'll do it again: Seizure Tracker, Nile, EpiPal, Epsy. Oh, I might have missed that one earlier. I'm sorry. Epsy, My Epilepsy Diary, Seizure, and Patica are the ones that we're aware of. But again, that may not be an exhaustive list, not necessarily an endorsement, but those that we know are out there. And Shell, we teed you up a little bit earlier in the conversation. There is a new tool that the Epilepsy Foundation has been working on called Eden. And seizure tracking is just one component of what we're trying to build into Eden. But I would love, Shell, for you to describe, what this tool is about, what we're trying to accomplish with Eden, and how people could help us actually develop this tool. We need some feedback.
Yeah, no, thank you, Brandy. Thanks again, like all of my other colleagues said, for having me here. I was so excited as they were talking, Dr. Ficker and Jessica were talking, because I'm like, we have an app for all of this. Everything that you all are talking about, we have this new app. And so like Brandy said, the app is called the Epilepsy Digital Experience Navigator. And it essentially, it is a new digital tool, digital platform that is powered by the Epilepsy Foundation, and we're partnered with Emblema, who is our technical team who is creating the app. And so what Eden does as a user, for a user, is you have a unique opportunity to manage and have and track your epilepsy all in one location. So, as Jessica and as Dr. Ficker were talking about, tracking your seizures, having it in one place, being able to track what type of seizure it was, being able to track if you were taking your medications, if you had other symptoms. Eden does that. Not only does Eden does that, it allows to bring all your information in from your medical health records. So your procedures, your blood levels, your medications that you are currently on, it brings it into Eden, as well as if you have a Fitbit. And so you have a Fitbit where you're tracking your sleep and your activity, which could be triggers. You will have the opportunity to connect all of that within Eden. Very easy steps. And I'm going to walk you through it, but I wanted to talk through, what Eden is and how you do that, and you connect those three things. So those are our main three features of what Eden is. But Eden essentially will allow you, one, to have all your information in one place, but also to be able to share your data with the epilepsy community so that we can start, inferring and putting all the data together to be able to tell a story. Data is really, really important. Data is key. It's going to really figure out how we get some, talk about more treatments, more discoveries within our community. And so overall, that's what Eden will do. But for a user, Eden allows you to have the information at your fingertips. You are able to share that with your providers. You will have that, as well as if you are a caregiver of a person living with epilepsy, you also can create an account on your own to be able to track those seizures. And so it's not only for people living with epilepsy, it's for caregivers. And so as Brandy was stating, we are in this phase where we are testing. And so the beauty of Eden and what we love and value about Eden is entirely built on feedback, feature requests, and overall thoughts of its current users. So right now we currently have about over 300 users right now, and they are really telling us what is working in the app. Is seizure tracking working? Being able to get reminders about seizure tracker, is that helpful? Is it not? We've been getting a lot of really, really great feedback about Eden and, what it is. I'm just going to give a quote, and I'm going to say it really slowly because sometimes me being from South Carolina, I can talk really fast. But one of the quotes that we got from a user is, "The text reminders to track seizures has been a lifesaver. It takes less than 30 seconds and is so simple and easy. Being able to go back and see how often I have been tracking my seizures will be so helpful when talking to my doctor." And I think I can also nod at Dr. Ficker when it is going to be very helpful to have that information to show at your visit or before, so that your provider can already have that information. It could decrease office visits as well. So that's a little bit about Eden very, very quickly. I will always tell people to go to epilepsy.com/Eden, EDEN. But I am going to share my screen right now to kind of walk you through Eden. So first I'm going to go to the website. So again, as we were saying, epilepsy.com/Eden. Here it walks you through what Eden is, checking if these statements below are true for you. I would like for the attendees on the call, if any of these are true for you, if you could say yes or put anything in the comment box. But, in terms of where you are with your epilepsy and seizure tracking, do you want to easily track your seizures? Seeing when I have started and stopped my medications is very important to me. Check it off or, think about it, internally. I often think about how my sleep is related to my seizures. I'm going to check that. I am looking for a better way to record, track, and manage my seizures. And again, like Brandy said, whatever is easiest for you, that's what we recommend. But we do believe that Eden will provide all the information in one place for you to be able to share and have that data for others, like providers and your family members. And then the last one is I want to help build a platform that will directly benefit others living with epilepsy. So not only are you sharing your data to help yourself and be a better manager and feel empowered by your information and data, you're also helping the broader community of individuals who are really looking for answers to diagnosis or treatment or how their medication is affecting them. And so joining Eden is easy. It takes less than, I say, 3 to 5 minutes. But within Eden, it does allow you, it shows you how long things take because we think that is important. I'm not going to go through all of this because I do want you all just to come to the page, check it out. It is really informative, but I will show you when you come to Eden, this is what it will look like. And so you can access Eden on your desktop, or you can download it on your Apple phone or Android. So you will be able to download the Emblema app. And it will direct you and give you all the links you need once you go through this. But this will be the first page that you see. You would just need to enter your first, your last name, your date of birth, your gender. Do not enter a center code, and then you continue. I'm not going to go through this because I don't want to take the fun out of when you're signing up. But I will say that it is a very easy process. You will get an email immediately after that will give you directions on exactly what to do. And so I am going to now go to Eden. I am using my colleagues. She is on demo site as we go through Eden because it really shows how you can see your data all at once. And so it's very intuitive. We call these our task cards, and it has surveys that you can take about your health check-in, your mental health. Just about your epilepsy. So in terms of saying, what type of seizures do you think you have, or what seizures have you been told that you have? If you've been seizure free like Jessica, you kind of get to tell your history along with quality of life. I will go directly to seizure tracking because this is where it is. And so it's a small card here. And as you can see, the last time that this demo test was tracked was March 31st. So that was 13 days. 13 days was the last time that this user tracked their seizure. And so we're going to go to start a new check-in and show you guys how easy it is. And so here it is, this first page. It just tells you, what this is, how long it'll take you, less than a minute. Because again, we do think that it's important to let you know how much of your time you will need to, track your seizure. So we're going to start. Did you have a seizure today? In terms of testing this and demoing this, we are going to say, yes, we had a seizure today. How many seizures did you have? We're going to say that we had 1 seizure. Again, in terms of how Dr. Ficker was saying, how many of these seizures were convulsions known as tonic-clonic, you can decide. And if you don't know, you can, leave it at 0. But if you knew what it was, you can put 1. There's also an option right here to write text that you would like. So if, this was some, a seizure that you didn't necessarily, you felt like it was a really bad seizure, we use that a lot. You can just say, really bad 1. And you can just leave it at that. Or you can put, I felt really bad after. That is where you can put whatever you need for your provider of what the seizure was or how you felt before or after. It goes down. And so this is where it gets intuitive. And this is where it goes in and kind of makes you understand the last time you tracked your seizure. So before today, did you have any seizures since April 1st? So we tracked a seizure on April 1st. That was, again, 13 days ago. And so did I have any seizures since then? I am going to say, yes, I did have a seizure then. And here it says, let's take a moment to log when they happened. If you don't remember the exact dates of each seizure you are reporting, you can also select the span. So what we're gonna do, maybe I don't necessarily remember when exactly I had a seizure, but I'm gonna go here, and I know the last one I had was the 1st. And so I'm gonna say, I think it was Wednesday or Tuesday, but I'm not sure. So I'm gonna select Tuesday, and I'm going to select Thursday because it may have been Thursday as well. And so I'm going to say that it was in between that time. I don't know the exact date, and that is fine. And so what it'll say, it will, it have the seizure that happened the 5th, the 6th, the 7th. That's better to know the range than to not know at all. So we're going to click OK. It's going to have it there. How many seizures did you have during this time? I'm going to say 2. How many of these seizures were convulsion? Again, I'm going to say 1. I'm not going to put a note here because I put 1 at the top. And then if you have another seizure that also allows you, if you had one after the 7th that you remember, you can also put that in again. And so here goes the question: during this time, did you miss any seizure medication pills? I'm going to say, yes, I think that I did miss it. And so I'm going to just select yes, that I did miss it. Did you miss 2 or more doses in a row? I'm going to select no. I know for sure I only missed one of my doses of my medications on one day. And then how many, did you have any side effects since the last check-in? So the last check-in is when it told you, which was April 1st. So you checked in your seizure on April 1st. So did you have any side effects? I'm going to say no, I didn't have any side effects. I feel fine, but I do remember having a seizure. And you have tracked your seizure. It says, thanks for checking in, go to your dashboard. So what I want to show you all, but also before I go back to say, when you are signing up for Eden, it will ask you, how often do you have seizures? So Jessica, I'm going to use you as an example. Right now you are seizure free. And so you wouldn't say that you have yours daily, but the choices are daily, weekly, monthly, and quarterly. And so you may decide that you want to just check quarterly. What Eden will do is we'll recommend, okay, since you haven't had a seizure in a year, we're going to say maybe you just check in quarterly. And even if you have not had a seizure, still check in no, because that's really just good information for your provider to know. And when you do that, you go through a process and it asks, would you like to get a push notification? Which, if you all don't know what the push notifications, it comes on the phone and it just shows up like at the front of your phone, and you see that it comes up. Or you can get a text message that comes directly to your phone when it's time for you to track. So it's like the medications that you were all talking about, where it just reminds you to track your seizures. And even if you don't have one, it's still good to do that. So what I'm going to do really quick is I'm going to show you all that seizure I just tracked. I want to show you all what it looks like in terms of showing all my data. This test demo has connected their health records to their medical center. It's really, really easy. You find your medical center that you see, whether it's the state in the city, and you connect your patient portal. So having your username and your password is very important. Once you do that, you go through a list and you decide what you would like to share with Eden. If you don't want to share your medications, or you don't want to share your labs, or if you want to share all of it, you have that opportunity to do that. And also connecting your Fitbit. If you do not have a Fitbit, I will say we are in the beta stage of this. And so we are working to get Apple Watch and other trackers that we have learned, from people telling us and giving us feedback about the trackers that they are using. But right now, currently, we only have Fitbit. And so I'm going to walk through this so that you all can see. It's going to take a little long because this is a test demo that we have been working with since November. So as you can see, today is the 13th, and here is the seizure that I just tracked. I can go to it. I can see the information that I tracked. I can show that I did say that I missed medications. I had no side effects. Also my notes that I said, really bad one, felt really bad. So you have this information right at your fingertips once you put the information in. So this was the 13th, this was today, but also right underneath it, it shows your activity and sleep of the day of the 13th. And so, we talked about those triggers. We talked about stress. We talked about activity and about sleep. And so here you can see that on the 13th, this test user, slept 6 hours, 26 minutes and walked 4,621 steps. Right now, this information we see it and we don't know, but for a provider, Dr. Ficker, this could be really good information, for you as you are looking to see what could have triggered. And like you said, it doesn't necessarily mean it triggered it, but that could just be helpful information for you. And it's the same thing. And it shows you, when you connect your Fitbit, which is really important because it shows you in terms of your sleep, how many minutes you were awake, what was light sleep, what was deep sleep, and what was your REM sleep. And I think that's just really cool information just to have in general. But this is what you will see, and this is how you will have all your information. So again, on the 7th is where, I tracked that seizure. I said I didn't know if it was the 5th through the 7th. Here's the seizure that I tracked. I said I had 2, and it shows up in my activity log. And so this is what Eden is. This is what Eden will allow you to do, have all your information here. We do have other, as I said, we are working to improve Eden. The feedback that we're getting from our users is really, really helpful in terms of saying, I am seizure free and, I don't necessarily know if I find value in Eden. And we've had users that tell us actually being able to track that I haven't had seizures has been good for my provider, because what we are working on is a provider doctor dashboard so that you can be able to share this information that we're seeing on the screen directly with your provider. You can send it to them in a link and they will have that before visit. And so they will be able to have this information in front of them as well as you will, and you'll be able to share that with a family member. If they do ask, do you remember the last time you had a seizure? You can go right into your app or log onto your desktop. I want to make sure I have enough time because I could keep talking about Eden and I can show a lot more features and just how easy it is to connect your health records. And so Brandy, if I can just get 2 more minutes, I don't want to hijack this.
That's great. And I'll just ask people, if you have questions about Eden, feel free to put them in the Q&A and we can try to get them answered either now or in a follow-up conversation. And again, we are building Eden to be useful for people with epilepsy. So we need to hear from you. We need to get more users onto the platform to make sure that it's going to be built in a way that's most valuable.
Yep. And so finding your health center, like I said, is really easy. If you remember your health center name or hospital or clinic, you can put it in, or you can just put city or state. So currently right now, I am home in Charleston, so Charleston, South Carolina. So I'm going to put Charleston and just see what pops up. So this is actually the hospital that I went to just, as a kid. This was the hospital I went to. And so it'll pop up. It's the Medical University of South Carolina. And I just connect, right? It's just an easy to connect. And what will come up is the patient portal, my chart, patient portal. I think a lot of other, there's a lot of different names. And I would just put in my username and my password and I sign right in. I go through and say what I want to share with Eden. And you're connected. It's really just that simple. It's just knowing, your health center and having the username and password. If you don't see your health center, if you want to go back and you do not see your health center, your hospital or clinic, then you would just need to reach out to me I would put it into the chat box, but Eden at efa.org, and we can make sure to get that in there. But we have a whole list. We have about 80% of health centers and hospitals around the nation who are connected to Eden. So it should be pretty simple.
Great. And Shell, I've heard one of the benefits people are experiencing with Eden is you can connect multiple health records. So if you see multiple providers and you have multiple patient portals, this is one way that you can bring all of that information together in one place. It might be helpful to share with your doctor, that these are the things that you're getting from another provider, et cetera. So having it all in one place can be a really useful value to Eden as well.
Yep, Brandy, another thing we heard from users is, I had surgery at a completely different hospital, but sometimes I want to see that information, or I would like to have that information so that I can tell my provider about it, you can put that information in from that health center or from that hospital within Eden, and then your current provider. You can put as many as you want. If you want to put 5 or 6, you can put as many as you want.
Great. So again, this is a free tool. We're still building it, still developing it. So it's in beta phase, but we absolutely need some users for feedback and helping us develop this to be as useful as possible. So thank you, Shell, for sharing all of that.
I actually have a question for Shell, actually,
Yes.
regarding Eden. Can the user create summary reports, like, the seizures, in 2021, for example, and list those by date, and because that's helpful sometimes to look at trends and over time.
So for the providers, so we're actually working, and we're going to release the provider doctor dashboard and come up with reports that are going to be helpful for you. So you just saying this right here, I'm going to be able to take that back and say, hey, can we get some summary reports from a previous year and take that? So that's the beauty of this beta stage, right? Getting the information from and learning before we release this tool and say, hey, use this. This is great. What's coming from our community. And so we think that is the benefit of Eden. So I wrote that down. I've been taking notes as you all have been talking, but I will write that down and share that with our team.
Shell, we got a great question from someone who is a caregiver, both herself and her husband.
Okay.
Can 2 caregivers have the app on their phones, both of them being logged in at the same time? How would that work?
Sue, that is a really, really great question. So what happens is you create a login. And so whatever that login, whatever that email that you use, you and your husband or whoever else is the caregiver can have access to that email. And as long as you both have the password, you can go into that app at the same time. You just need to have the email that was used for the account and then the password. And so Donna, great question. So I do not see the app in the Apple Store. That's a great segue. And so I was going to just say directly, just go to epilepsy.com/Eden, and there it'll give you a link to join Eden. What Eden, because Eden is the platform, but Emblema is the actual app. And so that's why we direct people to go directly to the epilepsy.com/Eden. The link will take you directly to that screen that I showed you with the purple and the red, and you can put your information in.
So thank you so much for joining us tonight. I want to thank again the sponsors of the Eden Project, which are Eisai and Otsuka. I'd like to thank our panelists for spending time with us tonight and helping to educate our community about seizure tracking and why it matters. And I'd like to remind all of you, seizure tracking is important because it is a critical piece of information for your healthcare team to help you manage your epilepsy in the best way possible. Remember, you want to write down the type of seizure, when it occurred, the date it occurred, what time of day it occurred, if there were anything unusual around the circumstances of that seizure before or after, and was there anything different in what you experienced. All of these things can be important pieces of information for your healthcare team to know. So with that, I want to encourage you to go out and find the way to track seizures that works for you. Paper diaries, calendars, electronic diaries, electronic apps. There's many options. Find the one that works best for you. And please remember to come back and see us again on epilepsy.com or at our next webinars so that we can walk along with you on your epilepsy journey. Thank you.